In this video, I want to show you one of my favorite exercises. I use this in the clinic almost every single day. If you guys don't know me, my name's Tony Maritato. I'm a licensed physical therapist. And while this exercise is walking across a balance beam, I use it primarily for patients who have had a total knee replacement. It's also an appropriate exercise for a lot of patients who have had any kind of ankle injury, foot problem. Maybe they have other kinds of knee surgery, hip replacement, or hip surgery. This exercise is also awesome for people that have shoulder problems, neck problems, low back, mid back, upper back. It's just something that humans should be able to do. You know, when I treat patients in my clinic, I look at what their functional deficits are, but I also look at what should a human do. A human should be able to move through space, whether it be walking or crawling or jumping or running. A human should be able to carry things, should be able to push and pull, should be able to lift and throw. So when I'm looking at my physical therapy patients, I'll take into consideration the condition we're treating, but I also want to focus on the whole person. So it's a holistic approach to physical therapy. Let's take a look at the video. Let's look at some of these exercises and I'll show you what I'm thinking about while I'm prescribing these. So to the side, you can see I've got a board on the floor. Now that board is a 1x3. It's about 3 inches wide. It's less than an inch tall. And the reason why I chose that board is you can use a 2x4 or a 4x4, but the taller the board gets, the more risk of injury. I'm not trying to increase my risk of injury. I'm trying to work my patient's balance and posture and coordination and proprioception. So a 1x3 is low enough that it still provides some safety. If the ankle rolls, it's not going to sprain, but it's high enough that it provides the nervous system and the proprioceptive system enough feedback so that the individual can feel where their foot is on the board. It's more challenging than walking a grout line or a piece of tape on the floor, which you've seen in other videos, but it's not quite as dangerous as walking on the side of a curb or a 4x4 or even a 2x4. So let's take a look at this first exercise. Very simple. I have a counter to my left, and I'm simply going to walk the length of the board, heel in front of my toe. Now, sometimes I'll ask my patient to touch their heel to toe if I want to increase proprioceptive feedback. Sometimes I'll tell them, go ahead and take a longer stride length. What you can't see in the video is that I actually have that board marked out so that there are 12-inch intervals. Sometimes I'll tell my patient to step longer than a 12-inch stride, sometimes less. Now what we're doing is we're going sideways, and I'm doing this on the ball of the foot. I'm doing this with the heel elevated. This is less about balance, and this is more about building the endurance through the ankle so that we can keep the foot in a heel up position. Now what I'm doing is I'm doing a toe up position. We're sidestepping, the heel is on the board, the toes are off the ground. And again, I'm working different musculature of the lower leg so that I can improve the shock absorption qualities of the muscles around the ankle and lower leg, reduce wear and tear on the spine, improve shock absorption, and build proprioception in those muscles.